Professor Anu, can you please explain the importance of including the impact of the coronavirus pandemic in your research work? And then I'll ask Dr. Sudi the same question from his perspective.
Yeah, thanks, Helen. It's a really interesting question. As we are looking at the impacts on health of youth disability and mental health, and we're also interested in looking at food and nutrition programs, we see COVID as being a really big disruptor. So we see people that were already vulnerable to these health shocks are now finding themselves in a more difficult situation because of COVID. So for instance, people that, young people working in urban areas had to go back to their rural households, and they're facing restrictions on their ability to work. So we think that COVID is a big disruptor, and given that Indonesia is facing COVID challenges, and South Sulawesi in particular, so I think it's really important to take COVID into account. Yeah, thanks.
Thank you. And Dr. Sudi, from your perspective, how important is it to understand the impact of coronavirus in a community like the ones in South Sulawesi that you're working in?
Yeah, thank you, Helen, and also Professor Anu for providing initial comment on this. And from my point of view, I think COVID-19 reveals our multiple vulnerabilities that significantly contribute to the higher fatality rate of Indonesia compared to neighboring countries in the region. And Pak Chris briefly also mentioned some of severe clinical cases that he is treating at the moment in the hospital. And if we analyze this in a deeper level, we can connect it with several root causes, such as the problems in relation to nutrition that was emphasized in the first session, such as stunting and also people with disability. These are the root causes that multiply vulnerabilities among a particular group. And when a big shock in the form of COVID-19 come and take place, we can see both at the downstream and upstream level the factors that may contribute to our high fatality rate. That's why in our pilot project and also in our incoming program next year, we are going to try to tackle these root causes in relation to nutrition and also to health literacy, particularly among young people and more specifically to young women, in order to enable us to reduce the root causes of our higher fatality rate that we are currently seeing.
Thank you, Dr. Sudi. And just following on from what you were talking about, I mean, I would like to go back to young people and some behaviors that you've seen in young people, but you've brought up now nutrition and how important that is in the early years. And if the nutrition's not received, then that puts children, as they turn into young adults, at greater risk of disease and health problems. Can you perhaps explain some of the work that you'll be doing within households to better understand some of these sort of foundation factors that lead to reduced health in later life when people become young adults, around stunting and nutrition, for instance?
Did you want me to answer that?
Yes, please.
Okay, thank you. Yeah, so that's really important, and we heard in the previous session about the importance of food security and also the importance of a diversified diet to address children's nutrition. So in terms of what we're doing, there is actually very little data available on dietary diversity at the household level and the challenges that households are facing. So one of the things that we would like to do in our SIPS project is to collect a household survey data and get anthropometric measures of children and women of childbearing age. And then we want to go and work with Puskesmas workers on the good diets that could be introduced in these households. Secondary data analysis is already pointing to gaps in the data that we hope our household data analysis will be able to address. And we'll also be working with key stakeholders to identify some of the challenges that households face in meeting their food security needs and the dietary diversity. And we've also done a bit of secondary data analysis looking at one of the largest social safety programs in Indonesia, which is the Raskin program, or the Rice for the Poor. And that has actually started to be replaced by a food voucher system called the BPNT. So what the BPNT is trying to do is to allow households to choose the food of their choice from e-warungs. So the advantage of this is that a household is able to choose more nutritious food that they would like, rather than just the in-kind rice subsidies that they were getting. So our analysis is actually showing that households that receive the BPNT program, which is targeted at the poorest 25% of all households, are actually having better household dietary diversity scores. And interestingly, this program has been rolled out in Maros, but not in Pangkep and Baru. So the household survey will allow us to see how households feel about receiving in-kind food subsidies rather than the voucher, and how they perceive these different programs to be. So that's one of the things we hope to find out through this household survey. But I'll just pass it on to Sudhi for more analysis.
Yes, thank you.
Yeah. Thanks, Helen.
Yeah, and I think also at the intervention level, after analyzing both primary and secondary data that we will obtain, one of our main goal is to provide or to strengthen nutrition literacy as well as health literacy among people in our study sites. In the previous session, both Pak Elan and Professor Budu emphasized the double or even actually triple burden of nutrition that we are currently facing in the form of stunting and adult obesity, and also deficiency in relation to micronutrient. And this multiple burden influence the high incidence or the high prevalence of non-communicable diseases at the later life, such as diabetes mellitus, cardiovascular diseases. They play an important role as comorbidity for COVID-19. So we are actually trying to address the root causes of the problem that we are currently facing, and many of the root causes are related to individual and household level of literacy in managing nutrition and health, particularly at the village level. That's why another component of our incoming project next year is also to try to seek possibilities to utilize the village fund allocations to be used in strengthening health programs at the village level, because actually village levels also have a huge potentials in many forms, including in the availability of fund. And following what Pak Elan said, what they are needed is a strengthening capacity in designing programs that address the local problems that they are facing.
Thank you, Dr. Suri. And just on what you've said, you know, you've already found some information just by looking at the data of some government programs, which you will dive into more. How closely are you working with different groups, stakeholders, and governments? Given that, you know, from we heard in the earlier session, there are definitely there's definitely interest in improving the health of young people. Could you perhaps give us an idea of the work that you're doing with governments, but also some other organizations? And perhaps if I can go to Sudi first,
Yeah.
and then back to Anu.
Yeah.
Thank you. Sorry.
Yeah, I think there are some advantages that we have since the beginning of the project, that many of the stakeholders that we are working both at the provincial and district level are the people that we already know. Such as at the current forum, we are having Professor Budu, who is both the Dean of the School of Medicine at Hasanuddin University, but at the same time also a key member of the government, particularly Governors Development Acceleration team. And this kind of good relationship can also be extended to the district level, both in Maros, Pangkep, Baru, and Parepare. And the fact that the current governor of South Sulawesi is also very supportive since the very beginning is a good opportunity for us. And now we also strengthen our support from the national government, such as the support from Pak Elan and his team, and also Bu Erna in linking our program more explicitly to achieving SDGs goals. I think this is a good modalities for us to strengthen the programs, both at the research level and hopefully also at the intervention level next year.
And Professor Anu, I think this is a particular area of interest for you as well.
Yes, so thanks, Helen, and thanks, Sudhi. So I was also going to add that some of the work that we're doing, in particular looking at the impacts of these programs on poverty, are something that TNP2K is also really interested in and I believe working on, and particularly evaluating the Rastra program versus the BPNT program is something that they would be really interested in, because we would be able to provide robust evidence on households' dietary diversity, and we think that also looking at the impacts on poverty is also something that TNP2K is really interested in. So I guess and also the some of the work that we're doing uses data from BPS. So we are quite interested in working with Bapenas and also the key stakeholders like Pak Isak for the disability groups. So we are really interested also in working with youth groups and women's groups and the local Bapedas as well, and Puskesmas and community workers. So, yes.
Which just reminds you about how many community groups and organizations there are working in these non-urban areas in Indonesia. I believe that Dr. Chris is still with us, which is great. We might just go to him. And Dr. Chris, thanks for staying with us.
Okay, Helen.
Thank you. We're hearing about some of the challenges facing households, and obviously young people are a part of those households. What are you seeing in terms of the impact on families and households of coronavirus?
Baik, terima kasih Helen. Mohon maaf ini posisi.
Thank you, Helen. Still at the field hospital. So what Professor Anu and Dr. Sudirman, with regards to the research plan in the future, as Pak Sudi talked about, he talked about nutrition. So the key word is what Pak Elan said earlier, is aligning the non-cash support to increase immunity through nutrition as part of preventing stunting. So this means that we must provide support at the lowest scope in the community health centers, the integrated health posts, to make sure that it's ongoing. During COVID, several activities for monitoring, evaluation of health, especially nutrition, for young people, for women and people with disability and children are interrupted because they cannot conduct these activities as usual, they cannot congregate as usual. So we do have, as Pak Alan said, we have the non-cash support being received individually by these beneficiaries. So we need to make sure that these benefits reach the proper beneficiaries to reduce poverty, to increase nutrition, and to increase immunity. And this will prevent diseases and the non-communicable diseases so that they are resilient and healthy. So that's what I'd like to add. Thank you.
Thank you. Thank you very much, Dr. Chris. And picking up on that, can I go to Professor Anu?
Boleh saya ke Profesor Anu?
I'm sure that Pak Suri can also add to this. To what
Saya yakin Dr.
extent
Sudi bisa
can you
menambah.
tell so
Excuse me?
far that the coronavirus has impacted household incomes?
Yeah, thanks, Helen. So I guess because of COVID, I haven't been able to travel to Indonesia. So the research that we've done here is basically looking at secondary data. And the BPS, which is the Indonesian Statistics Organization, they have actually conducted an online survey of about 87,000 people in Indonesia to look at attitudes towards COVID and social distancing, and also look at impacts on income and consumption. And it's really interesting that they were able to do this. I'm not aware of any such survey in any other country. But what is interesting is that we see that there has been, of course, as expected, there will be a decline in incomes, and there would be an increase in poverty. We would expect that. And this has happened mainly in the trade and service sectors, as also in Australia. But what is interesting is that South Sulawesi's income has not been as affected compared to other provinces. And we do see that there has been an increase in poverty of about 0.03 percentage points and in South Sulawesi. But what we see is, although the income has not decreased by as much as in other provinces, we have seen a decrease in expenditures and a decrease in online shopping. So those are.
Yeah, are you able to drill down the data enough to find out if that decrease is linked to buying food?
No, we are not able to. We just know that they have decreased the expenditures. It may be that they're just being more, trying to be more risk averse or don't want to spend as much because income is uncertain. But the biggest decrease is among the richest households. So it may
be discretionary. Yeah. Very good. Thank you. That is interesting. Dr. Suri, I can hear you. Anything you'd like to add?
And I think to add to Bu Anu's explanation, we can also see some other data or other studies that conducted particularly among vulnerable group. In the previous session, my colleague, Dr. Ishak Salim mentioned about the study conducted by the consortium of organization working with disability issues in the form of rapid assessment of the impact of COVID-19 among people living with disability. And we can see from this study the significant impacts of the pandemic in multiple levels, both at economic aspect of people living with disability, particularly the significant decrease in income and of course in expenditure, but also in other areas such as psychological impacts and also health impacts. So we can also see the impact of COVID-19, both among general population and among vulnerable groups should be seriously taken into considerations. That's why we also, in our incoming program for the SIPs, we also will explore more deeply about mental health issues and also disability issues at the study sites, because the mental health aspects of the COVID-19 is very important and already emphasized in many studies, and this is not uniquely in Indonesian case, but we can find in almost all countries about the ravaging impacts of mental health related problems due to many aspects of COVID-19, and this also should be taken into account in our program in South Sulawesi.
Thank you, Dr. Suryan. One thing we haven't discussed much yet, it's been mentioned, but we'll go into it more in depth now, is the issues around mental health, which is another core area that you're looking into. Now, I'm not sure who would like to answer this, but we also have a question from the audience related to this. Eliza Hunt is asking, although there is interesting work on determinants of health and mental health, we still have not heard anything specifically related to mental health measurement. As an example, depression, anxiety, non-specific psychological distress or well-being. Are these activities going on within PAIR? Perhaps Professor Anu, if I start with you, because I know that this is one area that you have definitely been looking at, and then Professor Suri and Dr. Chris, Dr. Suri and Dr. Chris, most welcome to jump in as well. Thank you.
Yeah, thanks, Helen. Yeah, so it's quite interesting. There's actually very little data on mental health. So what we've done is we've looked at secondary data sets from the IFLS, the Indonesian Family Life Survey, and we've looked at 2007 and 2014, and we've looked at the same group of people across both years, and we've looked at whether there has been a change in mental health for these individuals. And there is a measure called CES, which is a score of mental health. So it's about, there are about 30 different components, and they give you a score, and the higher the number, the worsening the score is. And what we've observed is that among youth, actually the mental health has worsened. So between 2007 and 2014, among the same group of people, aged between 21 to 30, so these people would have been 15 to, in 2007, and now what we find is that 7 years later, their mental health has actually deteriorated. So what we did is we just did some statistical analysis looking at socioeconomic and demographic factors that might explain worsening mental health, and we did notice that it's among the youth and married women that there has been a worsening of mental health. And of course, things like poverty and disability will make people feel more that they feel like their mental health is worsening. But of course, these are measures of mental health that are self-reported, so they're not perfect. We haven't been able to get them for South Sulawesi in particular because it's a nationally representative data. There's a very small sample from South Sulawesi.
Thank you.
Yeah.
Dr. Chris, if I can go to you on this issue, because you did talk about it a little earlier about the impact on people's health and their mental health in particular. Does what you're seeing echo or mirror anything that your research, the team that you're working with, that they're finding in South Sulawesi?
Baik, terima kasih.
Thank you. Thank you, Helen. I'll just add to the findings, the secondary data that Professor Anu discussed. It is true that mental health impacts overall well-being, especially their resilience in working and their ability to generate income, their resilience in social relationships. And And the cases that I found in COVID is related to mental health, where the stigma, so once a person is accused of having COVID, this will impact on drop in immunity, their resilience, and their ability to survive. So clinically, this is a burden, and this puts them eventually on a ventilator. So what we hope, as Professor Budu said earlier, that coordination in the field is separating them in a certain place, so for example, in the field hospital, and having a mental, the speaker apologizes. I believe we've lost audio.
He looks busy, doesn't he?
Just one moment, there was some background noise. So once again, to be honest, we have to see, as what Professor Anu has said, this will impact on the overall health. This impacts their ability to be resilient in fighting COVID. So that's all I would like to add. To be quite candid, this is the key issue. In addition to increasing their immunity, it's making sure that they are happy. So we provide therapy. We're not giving them antibiotics, antivirus. We're trying to make them happy, bring them joy, and to boost their immunity. And then they can recover and fight against the other non-communicable diseases as mentioned before. Thank you.
Thank you, Dr. Chris. We are short on time, so I'm perplexed as to what question to ask next. It's such a complex area, but so many important threads to it. I think just finally, what I might do is that it's been mentioned a few times, the difficulty of being on the ground to ask questions and get information with coronavirus. And of course, that's something that you're looking to work with, and hopefully in the future we'll be able to get out more. But Dr. Sudi, if I can just check with you, and then Professor Anu, it's a question from the floor about methods. How are the instruments, what are the instruments that you're using to assess dietary needs of the households and the limitations and challenges in the Indonesian context? You had mentioned this, but I guess there is interest in how you're going to dig deeper and bring communities on board to what you would like to get from them, because that, I imagine, would be quite difficult. Professor Anu.
Yeah, thanks. So maybe I'll answer this and then pass on to Sudi to talk about the community groups. So with regards to the instruments, so in the household survey, we are going to ask households to report their self-report on their food security status, like did they go, if any member of the household went to bed hungry and so on. So this, what are their coping mechanisms if they are food insecure? We'll also get measures of dietary diversity, the different food groups that they consumed in the last 24 hours and also the last week. So we get measures of household dietary diversity, and then we get measures of food insecurity. These are self-reported. Additionally, we would just get height and weight measures for children under 5 and their mothers, to get their BMI, and anthropometric measures to measure stunting using Z-scores for height for age. Yeah.
Thank you. And Dr. Sudi, last word to you, if you have a minute to give us your
and
answer.
I think also to improve the reliability or the validity of our approach, we are going to employ a mixed method approach, both utilizing quantitative survey, but also a significant part of our project, both in nutrition aspect and also in mental health aspect, will also use a qualitative approach, such as to explore their coping strategies, their barriers, and as well as facilitators stakeholders in facing challenges related to nutrition and mental health aspect of their life. And to add to that, we also work with local stakeholders, including in the primary healthcare level, who deal with these issues on daily basis, as well as to the non-government organizations working in this aspect, so we can provide a strong triangulations to obtain relatively comprehensive data to better understand the problem. Of course, this is not going to be perfect, but we try to strengthen the validity through these multiple methods and multiple resource.
Thank you very much, Dr. Suri, and that's where we'll have to leave it, I'm afraid. Unfortunately, we didn't get to ask as many questions as possible about disability, but to let you know that the team has found that there is not as great an understanding of the different kinds of disability that exist amongst young people and some of the supports that they need, and that will also be a part of their research. And I'm sure we can learn more if we keep track of them, as we will do. I would very much like to thank our panel speakers for today, Professor Anu Ramahan from the University of Western Australia, Dr. Sudirman Nasir from the Universitas Hasanuddin. Thank you. Thank you, Anu. And Dr. Kristojogo Sumatono from Universitas Airlangga, currently at the Field Hospital in Surabaya. Terima kasih banyak ya. Thank you very much, everyone, for your time and your insights.